Hey, what's going on, guys? My name is Addictory here, and today we're going to be doing a knee surgery to be specific. And let's see who the patient is, shall we? Let's go ahead. Okay, please turn on speakers. Okay, I already have that. Shut up.
Welcome to virtual knee surgery.
Thank you.
This activity will show you the process of replacing a failing knee joint.
Okay.
Are you ready?
Yes.
Today, our patient is a 76-year-old man. It is mandatory to check the patient's vital
Not laughing at
signs
that,
before
no.
beginning surgery. An anesthesiologist in the operating room performs this step. If the patient's vital
So do
signs
I
are
have to
not
do
in
it?
normal ranges, we will not proceed with the surgery.
Dude, I don't care.
Using the healthy person's vital sign chart as a reference, can our patient undergo surgery today?
Sure.
It looks like surgery will proceed as planned.
Okay.
Take a moment to look at our patient's x-rays. Which knee do you think needs surgery?
Both of them? This is a trick question. I mean, they look fine. I mean, this one looks a little bit beat up, I guess.
You're right.
Yes.
His left knee appears worn down and lacking cartilage, which is likely the cause of his pain. The nurse has begun prepping our patient for surgery by placing an IV needle in his right hand. Now it's your turn. Use the marker and write your initials on the proper knee to be operated on.
You say write my initials?
Silly, but it's an actual step taken to prevent wrong site surgeries.
Alright, get the marker. Alright. Write your initials. Wait, he's being for real.
Nope.
Oh.
Nope.
What?
Nope. 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 Nope.
Okay, whatever. Use them.
The anesthesiologist administers drugs through the IV and through a mask over the patient's face. What function should these drugs perform?
Okay, this is more of a freaking quiz. I thought I get to do something. I don't care.
Great.
Thank you.
After the patient is unconscious,
oh my, is he naked?
Before the first incision is made, we need to establish a sterile field around the surgical area.
Alright, do I get to do it?
A series of sterile drapes isolates the surgical field from the rest of the patient's body. A tourniquet is applied to cut off blood flow, which allows a clearer view of the surgical field during surgery.
I don't care.
To kill the bacteria on the patient's leg, clean it in a betadine solution.
Alright.
This scrubbing process will limit the chance of bacterial
infection.
infection.
Dude, they're like teaching me like I'm actually gonna do this. Alright, sponge, soak it, and get it all over your leg and your foot.
Betadine
there you
scrub
go.
is applied
I give you a
2
spray
more
tan.
times, followed by the final arrangement of sterile drapes.
Well, now he just kind of looks like a mummy. Wait, I didn't do that. Why didn't I get to do that? That was.
Why do you think knee surgery involves so many drapes?
Are you serious? I don't really care.
Use the sterile marker to draw the location.
Can I do it? Was it okay if I do it?
Perpendicular lines too.
Oh,
typically, the incision line is 6 to 7 inches long.
All right. Oh my gosh, go away. Sorry, unprofessional. There.
What purpose do you think the perpendicular line has? Outstanding.
I don't
Now
care.
for the incision.
Yes.
Take the scalpel and cut the skin following your markings.
Oh no. Oh, it's not that bad. Okay, that's bad. That's bad.
This will help decrease blood flow into the surgical field.
Grab the bovie. Alrighty. Oh, I gotta cauterize it. Is that what that does? Burn
The
you.
rake retractors fold the skin and tissue out of the way,
Yep.
exposing the patient's knee. To operate,
that's not
we
normal.
need the patient's knee elevated and bent so the bones are fully exposed.
I got this, doctor.
Now
yeah.
the legs at the proper angle. Use the rongeur to remove the anterior
I'm amazing at
or
this.
ACL, the meniscus, and any bone spurs that may be lurking about.
Alright, well, let's just cut it all. Just cut your whole knee out.
Are you a good sculptor?
I sure am.
It's time to shape the femur, tibia, and patella so the new knee components fit properly. A hole must be drilled inside the femur to set up the distal femoral cutting jig.
Just drill a hole inside of your knee.
The jig is put into position and helps ensure that the cuts made to the bone are exactly what are needed. Now hammer in the pins to hold the jig.
Oh, okay. We are hammering into his knee, I think. That's sick.
We can now remove the alignment device. The pins will hold the jig firmly in place. Now for some real
I'm
bone
so
shaping.
glad
Use
I
the
do
bone
not want to
saw
be a
cut
surgeon.
the bone so it is prepared for the new femoral component.
Wait, what is the bone saw? Okay. Just cut the whole top part of your knee off. I mean, why not?
Another cutting jig, along with the bone saw, allows us to finish shaping the femur.
Okay, that actually looks cool. You kind of like RoboCop or something. I don't know. Don't sue me, RoboCop, please.
Let's move on and shape
that's actually
the
a
tibia.
pretty cool shape.
The tibial cutting jig is aligned with the big toe and the highest point of the tibia. This will ensure the leg is properly aligned after surgery.
I feel like this
Secure
is
the jig
more
in place with more
of
pins.
a, what do you call it, a tutorial than like actual surgery. I don't know. It's more of a tutorial than a game, I guess is what I'm saying. I'm probably gonna have to use a different software or something next time I do it. Alright, let's see. Good sound.
Now we'll use the patellar cutting jig and
Alright.
bone saw to remove the back of our patient's
Yeah, let's
patella.
just take that off. Can we take it off, please? No? Yes? Oh yeah, just take it off. Ew. That's kind
Holes
of
in the tibia
gross.
and patella are drilled and chiseled out, which
Okay.
will enable the new
Why didn't
components
I get
to
to do
attach
that?
properly. Time to place the trial components. First, attach the femoral trial component.
Alright. Femoral component.
Attach the metal tray trial component to the tibia.
Okay.
Insert the plastic trial spacer into the metal tray component.
Alright.
Lastly,
I
attach the
clicked over
patellar
here,
trial
but
component.
The what? Oh, this thing. Okay. It's like a
Why
snowball.
do you think the two tibial components are inserted separately instead of as one unit?
How can you talk at the
Conduct
same
a
time?
range of motion tests to assure proper knee alignment and successful prosthetic fit. Typically, a normal range of motion allows the leg to move from 0 to 130 degrees. How
Alright.
does our patient's range of motion look?
It looks great.
Knees aren't meant to bend sideways, so it's important to determine whether there is a gap or space between the femoral
They're really
and tibial
not supposed to move
components.
sideways.
There's no
You have a
noticeable
problem
gap,
if that
so this
happens.
knee is a good fit. Why do you think there are so many steps taken
Why
to
do you
ensure
keep
proper
asking me
alignment?
these questions I don't care about?
We've tested the trial components. Now let's remove them and prepare for the permanent components by applying a special cement compound that binds metal and plastic to bone. A
They're gonna
scrub
put
technician
cement
has
on
mixed
his
up a
knee.
batch of
This is
cement for you to
great.
use.
Here. Oh yeah, cement.
With the cement in place, the final components are permanently attached to the knee.
That's awesome.
Any excess cement will be scraped off, thrown away.
Cool.
Lay the leg flat on the table so
Okay.
the new knee components put pressure on each other.
It won't let me lay it
This allows
flat.
the bone and components to bond with the cement.
Lay flat. What? Okay.
The cement can take anywhere from 10 to 15 minutes to harden.
Okay.
We perform our range of motion tests one final time.
Okay, I'm done testing, whatever.
Our patient's new knee is looking good. Let's
Yay.
close up the incision. First,
Alright.
suture the deep tissue and fat layers back together.
Okay. Where is that? Oh, we're just gonna sew them back up. Don't worry, friend. You'll be better in no time.
Closing the surface incision, you have a choice between the stapler and the suture.
What's the suture? Oh, I'm gonna use a stapler. Just give you some staples. Oh, yeah.
This is the primary difference between these two methods of closing the incision. Excellent. You know, we couldn't ask
You are the
for a
most
better
boring
participant.
person on the
You've
earth.
done an excellent job. Are you sure this is your first total knee replacement?
It
Our
is.
patient will remain in the hospital for 3 days, followed by 3 to 8 weeks of physical therapy. Because of this surgery,
Because
our
of you
patient
talking
will have
so much?
significantly reduced pain and increased
Wait, that doesn't
mobility.
make sense. That's
Before you
mental.
leave,
Okay, I'm sorry.
let's think about the life of the new
that
knee
sounds-
components. What kind of forces do you think
Alright,
the new knee
I think
will
the
need to
surgery
test
part
out?
is done.
People average about 5,000 steps per day. Our patient's new prosthetics will withstand a great deal of force, for 36 million steps or more. I'm off to check on another patient while the OR team prepares
Please
the room for
leave.
the next surgery. You've been a
Please.
great help. See you next time.
There won't be a next time, I promise you. You annoy me too much. Okay, well that was knee surgery. Ooh, we can look at some photos. Let's do that. Nope. Exit out. Exit. Okay. Oh. Thank you guys so much for watching. If you liked this video, be sure to leave a like, comment, or whatever it is you want to do. Subscribe if you really want more, and I will see all you guys in the next one. See ya.